So the topic today is cancer, colon cancer prevention and screening. So first I'm going to go ahead and tell you the difference between screening and prevention. Actually what we do and try to do is going by the name of the screening, colonoscopy or colon screening. But what we are trying to do is to prevent cancer, not to screen for cancer. The screening is to detect a cancer. You do mammogram to detect a breast cancer. You do chest X-ray in people who are smokers to detect cancer. But cancer is already there. It has to be treated. You suffer all the consequences of cancer when cancer is there. Prevention is preventing the cancer from affecting you. The biggest example of that has been carcinoma of cervix of uterus. It used to kill lots of women before and now is rare. Because in pap smears, you prevent cancer from happening. You detect early, you take care of dysplasia, cancer never happens. So that's the difference between the two. The screening colonoscopy is for prevention of colon cancer. Now, with the industry pounding on the door every place, you'll see a lot of advertisements in the newspaper, in your TV, in your computer about the stool test. It's a great screening test, but it's a screening for cancer. It does not prevent. If you have cancer, it will find 90% of the time. Okay. The risk of colon cancer in the screened population in the United States, that's about 60% screened now, is 1 in 20. Non-screened population, just to the north, in Canada, where they started late, it's 1 in 11. So already it's making an impact of preventing half the colon cancer. And this year, our goal is to get 80% of our population screened. That's the slogan of the American Cancer Society, 80 by 2018. It can be prevented. It's number 2 killer in both men and women. And this is key thing to remember between screening and prevention. Prostate cancer, you can screen, you can find out early about it, you can treat it, but you cannot prevent it. Breast cancer, you cannot prevent it. Colon cancer can be prevented 95–96% of the time. We use the term 90 to give the room, but at least 90% of the time it can be prevented. So, this is colon. This is the last part of your intestine. The main purpose of it is to absorb the liquid from your stool to make it more firm and you don't lose too much electrolyte and fluid. Colonoscopy detects polyp. 97% of cancers that occur start out as a polyp, 3% of them don't start as a polyp, they start directly as cancer. So those cannot be prevented. So this is how it starts. If you, initially we have a very small lesion, grows, and gets into cancer stage. The goal is to detect it in this stage, where it can be removed and it never turns into cancer. Some polyps are difficult to see. This one, the other, you can see it easily. That will be difficult. That's why you need good training and good help. The procedure is simple. The most difficult part of the colonoscopy is to make up your mind that you're going to have one done. Next most difficult is to get prepared for it, because you take liquids that give you a lot of diarrhea to get all the stool out of the pore. This is very important because if the stool is not removed, it will cover part those particularly tiny polyps, and you may have a psychological satisfaction that you had a screening done, but you didn't have a good screening. The scope looks like this, and we pass it along the whole area, and we examine it, and polyps that are seen are removed. The example of a polyp, has been removed there. So, we went through some of these numbers already. The age for starting screening for the average population is 50. Colon cancer can happen in age earlier than that. 4-5% of the cancers happen earlier than that. 95% of the colon cancer will happen after this. People who are at particular risk for earlier age are people who have family members with first degree relatives with colon cancer. They should be screened at age 40. African Americans have higher incidence of colon cancer at early age. They should be screened at 45. For the rest of the population, screening starts at 50. There are some factors, some are the family members with colon cancer, family members with adenomatous polyp, smoking, obesity, everything other than ulcerative colitis and Crohn's disease contributes to the smaller disease. The use of single aspirin a day, some folate, calcium, and selenium. I think you'll have some more feed on that. It is associated with less incidence, but not to the extent that you can skip the screening colonoscopy. The important part is to remember that everybody needs to be screened. No excuses. That's completely preventable. Colon cancer is not something that you can think of as a terminal disease that fine, I'll get a cancer, I'll die. There are cancers that kill very fast. Unfortunately, for those who make that kind of decision, colon cancer kills you very slowly because it's a slow-growing tumor. And it spreads to liver, it can cause blockage of the intestine, continuous bleeding, metastasis to bone. It's a long disease, it's a painful disease. So you don't want to take it that risk. So we talked about that. It does not need to be due too frequently. For the 65 to 70% of the population, it only needs to be done once every 10 years. And if you did not have any polyp, it does not need to be done after a certain age. So those who have no additional factor and had their last screening at age 75 don't need any more screening. That particular one I'll modify because we live in this area where we do have a lot of people age 90 and 100. The reason for that is not that cancer doesn't happen beyond that age. The reason is that the chances, the life expectancy beyond that age is not enough to justify screening in the general population. However, if you are somebody in good health, has family history of long life, has to be considered individually. As I said earlier, African Americans should be screened at age 45. We went over this. If we find polyps, adenomatous polyps, not all polyps lead to cancer. Adenomatous polyps do. If we find adenomatous polyps, the recommendation is that if you are satisfied that examination was good, the polyp is completely removed, they only need to be checked every 5 years. Certain types of polyps where you have doubt about complete removal or the patient was not to your satisfaction may need to be checked sooner. 3 years is for some of them. If it's unsatisfactory removal, we usually check them back in 3 to 6 months. Now, cancer detection test can be the stool test. You can do it every year. It's cheap, it's non-invasive, but it's a screening for cancer. It does not prevent cancer. The alternatives that are is Sigmoidoscopy with barium enema, This is what you are seeing on the TV these days, the Cologuard, the chemical sensor. This is for cancer detection. This is not for cancer prevention. I'm not going to go through. I think the population here is pretty well informed about how to get a colonoscopy done. There are just a few important points in that. Neighbors to the north, in Canada, they did a study where they found that colonoscopy did not make any difference in the incidence of colon cancer. That was 11 years ago. And so we looked at what was going on. And they found out that majority of their colonoscopies were not being done by gastroenterologists. Because there's some money involved, so some surgeons were doing it, some internists were doing it, some family practitioners were doing it. The training and expertise is extremely important. Colorectal surgeons or gastroenterologists to get the training through for this specific thing. In general, a gastroenterologist through their training has seen done between 1,000 and 1,300 colonoscopies. A surgery training minimum requirement is 25 colonoscopies. So this is important. The centers and facilities are important. That it's not required by any body of regulators, but as the college, American College of Gastroenterology, American Gastroenterology Association, we have set up our own requirement that if you do a good colonoscopy, you find polyp over 30% of the patients. We call it abnormal detection rate. That's our benchmark of finding a colonoscopist is doing adequate work, quality work. So it is important because it's an observer-dependent test to find appropriately qualified colonoscopists. Remember, you only need to get it done once every 10 years. So if something is missed, it will be too late. The important message is that it's a preventable cancer. Just in the last 3 months, in Oswego, we have had 5 colorectal cancers. That's just 5 too many. The youngest person that is inoperable is 52 years old. There's no excuse for this kind of loss of life. So, this is, you feel fine, you have colonoscopy. You're healthy, why should I get a screen? You get a screen. No one in my family had colon cancer. Most people who have colon cancer don't have anybody in the family. So you don't need to be the first. There are no risk factors. The biggest risk factor is your age. And that's not true. Okay.
My dad's alive at 94, my mother died at 93, so probably the 75-year rule won't work for me.
Will not apply. If you are in good health at age 75, it won't apply. Because the incidence of colon cancer in 80 is actually higher than colon cancer incidence at age 50 or 51. But the likelihood that a 75-year-old is going to be living at age 85 is only 11%. So 89% of the people will be dead before that age when the next colonoscopy otherwise would be due.
Now, in terms of location, are more polyps found in the sigmoid or in other areas?
Polyps are actually distributed all over.
Okay.
And scientifically speaking, it's about the same distribution. initially, when we had lower magnification or lower resolution scopes 30 years ago, the only pedunculated, those round ball-type polyps that we saw, only those could be detected. And those happen more commonly in the left colon, sigmoid colon, disease rectum. With better and once they started doing that, they started saying more cancers in the right colon. So the right colon, more lesions are flat. And even today, one of our internal analysis benchmark, when we analyze data sent to us from the college, from different places, the benchmark is that how often are you detecting those flat polyps in the right colon? So that tells us how well the examination is being done. So it's just the type, distribution is all over the place.
Does breast cancer increase your risk for colon cancer?
Any cancer increases your risk for any other cancer in the body. The data on the breast cancer has not been updated, but in 70, up to 70, 20% of all people who got breast cancer in their lifetime had developed colon cancer. 3% of the people had colon cancer at the time the breast cancer diagnosis was made. But mind you, these were the times before the screening for either breast or colon cancer was being done. So yes, the ovarian cancer, uterine cancer, breast cancer, they all increase incidence of colon cancer. Cancer in any part of gastrointestinal tract increases the chance of colon cancer.
So I should be screened sooner than the 5 years?
No, you don't need to be screened sooner than 5 years. The rate of your cancer, your polyp growth is no higher than general population. The only time where sometimes we recommend screening at shorter intervals is people who have received radiation to the colon area for uterine cancer. So they have two factors. Number one, they had uterine cancer that increases the risk of colon cancer. But they also had radiation which increases the risk of cancer anyway. So between those two factors, we take a little extra precaution in those days.
Thank you.
My name's Allie. I'm the dietitian for the Bariatric Center. And today we're going to be talking about colon health and nutrition. So as Dr. Roy mentioned, that your colon is your large intestine. Made up of 4 parts: your ascending colon, your transverse colon, descending colon, and sigmoid colon. Its primary function is to remove water, salt, and some nutrients forming your stool. It contains bacteria to help with digestion. So colon cancer, one of the most common forms of cancer and the most common forms of death for men and women. Like Dr. Roy said, we find these polyps when we do a colonoscopy. The nutrition-related risk factors include obesity, alcohol consumption, and red meat consumption. Colon cancer may lead to a possible need for tube feedings, bowel rest, meaning maybe TPN, which is nutrition for your IV, and maybe even a bowel resection. So a healthy diet, high in lean proteins, fruits, vegetables, whole grains, healthy fats can not only prevent future health problems associated with the colon, but can help treat current problems as well. Reducing intakes of cholesterol, saturated fats, trans fat, sodium is good for overall health in general. You can see there that is the MyPlate model. This is the latest version of the food pyramid. So you can see on the left, half of it is made out of your fruits and your vegetables. You have a quarter for your grains, a quarter for your protein, and a small serving of dairy. So having most of your intake come from your plant-based sources, your fruits and your vegetables. So obesity. So obesity is a main risk factor for colon cancer. So watching portion sizes, making healthier choices, getting enough physical activity can help prevent obesity. So fiber is a kind of carbohydrate not easily digested or absorbed by the body. There are 2 kinds of fiber: soluble fiber which dissolves in water to form a gel. It helps lower cholesterol levels, like you hear on your oatmeal commercials, right? Helps lower cholesterol. Also helps with lowering blood glucose levels. It's found in your oats, peas, beans, apples, citrus fruits, carrots, barley, psyllium fiber. And then your insoluble fiber, which helps with constipation. It's found in your whole wheat grains, beans, vegetables, cauliflower, green beans, potatoes. Most of your plant-based foods will have some amount of both of those kind of fibers. Eating a diet with a lot of fruits, vegetables, and whole grains ensures that you get enough fiber intake. Usual recommended amount is 25 to 30 grams a day. So there are also fiber supplements out there in the market that you probably heard of, Metamucil, things like that. So while they still provide some fiber, if you're missing it throughout your diet, really a better source would be from the whole food. So some tips to get more fiber in: maybe choose a high fiber breakfast cereal straight off your day, something with whole grains on the title, or wheat bran. Choosing whole grain products instead of your white products in your breads and your rices and your pastas. Eating more fruits, vegetables, beans at your meal times or in place of maybe a less nutrient-dense snack. A diet high in fiber has been shown to decrease incidence of colon cancer. It has the also added benefit of providing a feeling of fullness, which would help if you're trying to lose weight to help prevent with the obesity factor. One study showed that for every 10 grams of fiber in the diet, the risk of colon cancer decreased by 10%. Studies did not seem to favor one type of fiber over the other. So when you increase your fiber intake, make sure to increase it slowly over time to avoid some gastrointestinal discomfort, and to make sure you're also increasing your water as you increase your fiber, because like we talked about, soluble fiber dissolves into your water, so you need the water with the fiber together. So processed foods and red meat. So higher intakes of red meats, processed foods, processed meats have been shown to increase the risk of colon cancer, because those diets high in red meat are often lower in fruits, vegetables, and fiber. Your processed meats, those are your deli meats, your hot dogs, bacon, sausage. Study shows fish and poultry have been shown to decrease your risk of colon cancer. Red meats also have high amounts of saturated fat, which is not good for things like heart disease. Instead, eat more fish, poultry, seafood, vegetarian sources of protein such as beans, peas, lentils, nuts, seeds. One study in particular showed a higher increase in tomatoes in the diet, associated with the 50 to 60% reduction in the risk of colon cancer. And also be careful while you're cooking. So fried meats or darkly browned burnt meats, those are carcinogens there, which are cancer-causing items. So when you're cooking your meats and things like that, try not to get the temperature up too high. That helps you to marinate your meats ahead of time so they are a little moisture. You won't be apt to burn like that. A study showed 100 grams daily of red meats associated with a 12 to 17% risk of colon cancer. And when we talk about refined or processed foods, we're talking about canned fruits and vegetables instead of the fresh form, pulp-free juices, white breads and pastas instead of the whole grain form. When you're refining these grains, you're removing the outer coat, which is the bran, which is where all your fiber is held. Okay, alcohol. So a study showed that high intakes of alcohol is also connected to higher risk of colon cancer. So the recommendations are, if you don't already drink, don't start. If you do drink, limit your beverages to 1 drink a day for women and 2 a day for men. And remember, 1 drink is equal to 5 ounces of wine, 12 ounces of beer, and 1.5 ounces of liquor.
A little sexist.
Unfortunately. And not only alcohol alone, but alcohol with folic acid. So studies have been shown, particularly in men, that higher intakes of folic acid seem to prevent the formation of colon polyps that could eventually turn into cancer. And lower intakes of folic acid along with high intakes of alcohol in women was shown to have a higher tendency towards colon cancer. So just a reminder, your food's high in folic acid. They come from the same place we find all your fiber too, your leafy greens or citrus, beans, bread, cereals, rice, pastas. So polyphenols, phytochemicals, flavonoids, these are all really long sounding words. And again, we find the same place we find everything else that we've been talking about in your fruits and vegetables. Here's a couple in particular. Please don't ask me to pronounce all these. But these are things found in your fruits and vegetables, all of which have been shown to inhibit the production of cancer cells. Calcium and vitamin D. So there's some evidence on calcium and vitamin D. It's a little bit mixed. Some studies showed no relation between calcium, vitamin D, and colon cancer, while others showed some connection. There was a study that showed the risk of dying from colon cancer was highest in the areas of less sunlight. So that's unfortunately something we can't change unless you decide to move out of New York State. That's something to keep in mind. Another study showed that in the Faroe Islands, which are just north of England and a little bit south of Iceland, where their diet is high in fat, fish, calcium, vitamin D, but low in vegetables, have some of the lower incidence rates of colon cancer. Surprisingly, with less vegetables, but the added vitamin D and calcium. So, while even further research showed a greater protective effect when those two are combined together, the calcium and the vitamin D together. Calcium and vitamin D are beneficial for other health reasons as well. Calcium, of course, is for your good bones and teeth, nerve function, blood pressure. Vitamin D for your metabolism, mood, depression, things like that. So it's still a good idea to make sure you include enough of these in your diet. So coffee. It contains antioxidants, anti-immunogenic components, inconsistent guidelines on the recommendation as far as coffee. But studies showed that substantial consumption of coffee was associated with lower chances of colorectal cancer. Coffee stimulates a response in the colon to reduce the fecal transit time, reducing the amount of time the gut is exposed to the potentially carcinogenic stool. So you have bacteria all throughout your intestines. It's not a bad thing. It's not going to hurt you. They're supposed to be there. So these are found in many fruits and vegetables, such as the skin of apples, bananas, onion, garlic, artichoke, chicory root, beans, in very small amounts. Can also be taken as a supplement form. And then probiotics, so that's your good bacteria that live in your intestines. They've been shown to be helpful for patients with diarrhea, irritable bowel syndrome, inflammatory bowel syndrome, and maybe symptoms you might have if you have been treated for colon cancer. Maybe you're going through a resection, you're just getting back to solid foods again. That might be helpful there. They are found naturally in some foods: yogurt, kefir, kombucha, sauerkraut, kimchi, or they can also be taken as a supplement as well. So if you've noticed any of the strains out there, they give you the number of strains that are there. There's all sorts of strains of these good bacteria. It's hard to know which ones we're actually missing. So looking for a supplement that maybe has a wide variety of strains might do well. That way you figure out which ones you're missing. Also the added effects of boosting immune system, helping with digestion and irritable bowel syndrome. All right. Well, any questions about all that? So basically having a healthy diet not only helps with colon cancer, as well as weight, diabetes, heart disease, hypertension, all sorts of good reasons to eat healthy. And March is National Nutrition Month, so eat healthy this month.